Okay, I have washed my hands and I'm creating privacy for my patient. Hello, my name is Holly. I'm going to be your student nurse today. I'm going to do a head-to-toe physical assessment and it's probably going to take about 15 minutes. Do you have any questions? Okay, can you tell me your name and date of birth?
Justin Timmerman, 06/02/75.
And why are you here today?
For a physical.
And do you know where you are?
My house.
And what year is it?
2013.
Okay, I've just assessed his level of consciousness. He is alert and oriented ×4. He's clean and well-groomed, and his speech is articulate. I hear no signs of slurring. All right, I'm going to go ahead and look at your skin. Okay, skin is warm and dry, consistent with genetic background. I see no lesions or bruising. I'm going to go ahead and assess for dehydration here. Okay, Turner is elastic. There's no signs of dehydration. Now I'm going to go ahead and look at your eyes. You'll just look across the room for me. Okay, pupils are 2 millimeters and they are bilaterally symmetric. I'm just going to shine my pen light here. If you look at my pen light. Okay. Alright, pupils constrict and converge. They are reactive to light. Now if you'll just look across the room and then look at my pen light. Alright, they constrict and converge here. They were reactive to light the first time I tested it. They constrict and converge here. That shows signs of accommodation, so that perla is intact. Now I'm going to check your ears. I'm just going to palpate them. Let me know if you have any tenderness. Alright. Okay, no tenderness on palpation? Okay, so there's no signs of cerumen or discharge. Now I'm going to check your nose. Alright, the nasal mucosa is pink. The septum is midline. I see no signs of drainage or lesions. If you'll just go ahead and occlude one of your nares. Alright, now the other. Okay, the nares are patent. Airflow is free. Now we're going to move down to your mouth. Just open up and say ah.
Ah.
Okay, I can see your tonsils. See them very well. I'm going to give that about a 2+. The buccal mucosa is pink. The uvula and soft palate rise symmetrically. Cranial nerve 9 and 10 are intact. If you'll go ahead and say ah again. Now touch the roof of your mouth. All right, now stick your tongue out. Okay, very good. Cranial nerve 12 is intact. Let me go ahead and look one more time. Okay, the teeth are firmly attached to the gums. The gums are pink. I see no signs of gingia in the gums, and I see no caries in the teeth. Very good. Okay, now I'm going to look at your trachea. All right, trachea is midline, slightly movable. All right, now I'm going to listen to your heart, and I'm going to listen to your lungs. Okay, we're going to start with your heart. I'm going to listen with my diaphragm, and then my bell. And I'm going to take your apical pulse here, and that's going to take 1 minute, okay? All right. Okay, I'm starting in the second intercostal space, right sternal border. I'm listening for the aortic valve. Moving over to the second intercostal space, left sternal border for the pulmonic. Third intercostal space, left sternal border, listening for the Erb's point. Fourth intercostal space, left sternal border, listening for the tricuspid valve. Now I'm going to go to the fifth intercostal space, midclavicular line. Listening for the apical pulse, and then also the mitral valve. Okay. Apical pulse is 62. His heart has a regular rate and rhythm. I'm going to listen with my bell for any murmurs. I hear no murmurs, gallops, or rubs. Now I'm going to listen to your lungs. If you'll just go ahead and sit up in the bed, take a deep breath in and out, and if at any time you get, if you get a little lightheaded, just let me know and we can take a break. Okay. All right, I'm listening for the bronchos. Okay. Come up here. Going over and down here. Okay. Anteriorly, the lungs are clear to auscultation. Okay. All right. Posterior and laterally, the lungs are also clear to auscultation. Okay, I'm going to go ahead and look at your upper extremities here. And check your brachial pulse. Brachial pulse is a 2+, bilaterally symmetric. Check your radial pulse. Radial pulse is a 2+, bilaterally symmetric. I'm going to go ahead and check your pulse here again. Okay, respirations are smooth and effortless. The respirations are 14. All right, also, I'm just going to go ahead and, if you will pull on my fingers. Strength is 5 out of 5, bilaterally symmetric. And let me check for cap refill. Okay, cap refill is very brisk. I'm going to check for edema over bony prominence. All right, no signs of edema. Your skin is warm and dry. All right, I think that's it. If you will go ahead and lay back, I'm going to go to the lower extremities. All right, no edema in the lower extremities. And your skin is consistent with your genetic background. I think I might have said that, but just in case I forgot. All right, we are going to check your posterior tibialis right here and below your ankle. Okay, I'm going to give that a 2+. Those are bilaterally symmetric. Now checking the dorsalis pedis pulse. Okay, I rate that a 2+, bilaterally symmetric. Okay, assessing for cap refill in the toes. Okay, cap refill is brisk. You'll just push against my hands. Now pull. Okay, dorsiflexion and plantar flexion, I rate that a 5 out of 5, bilaterally symmetric. All right, now we'll just listen to your abdomen and then we'll be done. All right, I'm going to listen first and then I am going to palpate. I'm going to start in the right lower quadrant. Moving in a clockwise motion. Okay. That was your normal active times 4. Light palpation. Any tenderness when I palpate? Any pain? No? Okay, very good. Now I'm going to palpate for your bladder. Can you take a deep breath in? All right, now your liver. And your spleen. organs upon palpation. Very good. Okay, I think that that's everything. I'm just going to check my card really quick. Okay. I think that's it. Just so you see my card. All right, I think that that is all for your assessment. Thank you very much for coming in today. Is there anything else I can get for you?
Nope, that's it. Thank you.
All right, well, thank you and have a great day. And just let me know if you need anything else.
All right, I will.